The one nice thing I like about this study is they did a bunch of redo procedures on patients who had recurrences. So out of their patients who had recurrences, about a third or more underwent a redo procedure. And what they found in their redo procedures was, as you see on the right side over there, in the redo procedures, N of 26, that 85% or majority of these patients actually had durable posterior wall isolation, but they still had recurrence. So despite PVI posterior wall and reasonably healthy voltage, as you can see on the other side, these patients still had recurrence of persistent atrial fibrillation. Some patients actually had an atrial attack coming from the roof area, where you would assume the septopulmonary bundle would be. And a very minority of patients, about only 15%, actually had reconnection of the posterior wall. So we can say that we can get good endocardial posterior wall isolation with pulse field ablation the way it stands today. But we are still not seeing clinical benefit at all in patients who have persistent atrial fibrillation or long-standing persistent atrial fibrillation. And of course, there's an editorial here that sort of talks about, does it really work? And there's a lot of chatter now, are we really vaporizing the posterior wall because it's easy to do or because there's actual clinical benefit?